Hello and welcome to Medentee Talk. Our guest today is Professor Georgi Chaltikyan. Welcome.
Thank you very much.
Please introduce yourself to our audience.
Yes, Georgi Chaltikyan. I'm currently professor for digital health and head of digital health masters at Deggendorf University of Applied Science. We call it Technische Hochschule Deggendorf in German, or Deggendorf Institute of Technology. It's a university in Bavaria, in southeastern Germany. I joined that university nearly 9 years ago, eight and a half years ago. My background is, I'm a medical doctor, trained as surgeon, general and laparoscopic surgeon, and practiced for about 20 years. Medicine and surgery, and also taught medicine and surgery at Yerevan State Medical University. And all of that has been happening up until roughly 2014-15. But since 2008 we got quite interested, and I would say even enthusiastic about technologies, digital technologies in medicine, in healthcare, and together with several like-minded colleagues and enthusiasts, we founded Armenian Association of Telemedicine. Back then, recently it was renamed into Armenian Association of Digital Health. And I'd be happy to say a few words about that important part of my life and career as well. So through the society, through that non-profit, we got engaged in the international, I would say actually global telemedicine, and then later digital health or e-health community. I mean, it has been also developing, as you and many others probably know, right? From telemedicine through e-health, and eventually we came to what we currently are referring to as digital health, as a wider domain, as the umbrella term. So, and in accordance to with that trend, we also renamed 3 years ago our association into AADH, Armenian Association of Digital Health. So through the association we began networking and conducting, also organized a few quite interesting, I would say, and successful projects in Armenia, but with international participation. And among our international partners was this exact university, Deggendorf Institute of Technology. And then when in 2015 DIT was establishing a new campus, an international campus that is called European Campus Rottalin, and they were establishing a study program in digital health. And I was essentially invited by my colleagues at DIT to join the school as a tenure track professor, and since then I've been essentially working at DIT and developing that program with a lot of international, of course, activities, with engagement in collaborating with many actors, both Bavarian, at the state level, at the national level, at European level, and of course also internationally and globally. So this is basically, in a nutshell, what I do. And I also remained, of course, very much connected to my home country, to Armenia. I am on the board, and actually the chairman now of the board of the Armenian Association of Digital Health, and we continue supporting the developments in digital health in Armenia. So it's basically the two main hats, so to say, that I am kind of wearing. One is professor in Germany, and another among the leadership of the Armenian Association of Digital Health. At the same time, I'm very happy to say that since a few years we have succeeded in establishing the same Masters of Digital Health at DIT. We exported it backwards, so to say, to Armenia, And currently we're operating the same Master of Digital Health also in Armenia at one of the leading universities, leading higher education institutions in Yerevan, in the capital of Armenia, which is called Russian-Armenian University or Slavonic University. And that program is essentially operated as a double degree program, which means that students who are admitted, who join the program in Armenia, in Yerevan, they have a wonderful opportunity to also take some courses and even 1 or 2 semesters, entire semesters, here in Germany, and eventually receive both diplomas, a double degree, a diploma from Armenia and also the German diploma. And that endeavor is also supported by the European Union under the Erasmus Plus program. So the students also have this brilliant opportunity to do student mobility. Of course, we also organize staff mobility, so there is now a lot of interaction and links between DIT and RAU, the Russian-Armenian University, and a lot of collaborative projects. So it is, I think, quite a successful example of collaboration between Germany and Armenia.
Actually, it's an amazing story and a very extensive experience. But one question is regarding your career switch. You were quite successful surgeon, clinician. What encouraged you to change that and to go to education to unknown field of digital health?
A very good question. Thank you for that question. Well, I would say there were several factors. Of course, I began my career, as you very rightly mentioned, as a clinician, yes, and I practiced as a doctor. But quite early, I also engaged in education and research. It was academic clinical career, and for quite a long time, I also worked as associate professor of Yerevan State Medical University, so teaching basically surgery. So I have been into education, into teaching from quite early in my career, and I have to say education is something that has always appealed to me. I've always felt very much into trying to share knowledge. Education, to me, education is everything about, supporting young people, supporting them in their professional growth, sharing knowledge, and sort of, in a way, hopefully also trying to shape a little bit their professional growth, their mentality, even if you wish, and that is something that I've always been very, very fond of. So even back in 1990s, mid-1990s, when I just came into one of the large hospital in Yerevan as a surgical resident, and I remember very clearly we received back then there were probably 2 or 3 PCs, computers, in the entire hospital. One of those, and it was, I believe, probably at the stage of Pentium 2 or something. We're speaking 94, 95, when I just graduated from medical school and joined the surgical residency program. And already back then, one of those computers was at our office in our surgical department, and myself and a very good friend and colleague of mine, who is currently one of the top surgeons practicing actually in Qatar, in Doha. And together we experimented already back then with electronic, something like that could be considered a predecessor of an electronic medical record, because we were basically doing it on the computer. The bottom line, I guess, is that already back then, and I have always been interested, in these technologies, and at some point, to be honest, I felt that I would be more interested in these, following and hopefully even supporting or contributing a little bit to this global development in technology, yes, and trying to, I feel that I might be able to, yes, to impact, as you said, a little bit more in that direction. But all in all, I am absolutely happy that I am working in digital health, that I consider myself to be a digital health professional. And I believe this is something that really excites me, and because it is undoubtedly, to say that digital is the future of health is not to say anything, basically. As we commonly say nowadays, that there is no health without digital. And furthermore, I even tell my students that there is no digital without health. Meaning that even though healthcare, medicine was relatively late, to start that journey of digital transformation for obvious reasons, there is absolutely natural conservatism in health and medicine as a critical service. It is super complex, very data demanding and information rich domain. As we know, some according to some estimates, already now minimum 30% of all digital data, everything in the world, is related to health and healthcare.
Yes, it's a huge industry. That's
one third. And my prediction is, and this is what I also, because I kind of try to also give my students, my followers, everybody, a little bit of also glimpse into the future. I myself am sort of very much future-oriented. Some people would say that I sometimes, think a little bit more about the future than, kind of down to earth. But what appears to me absolutely undoubtful is that 5-10 years down the road, a little bit further, because we're just witnessing right now the very dawn, I would say, of the digital transformation of healthcare. I always tell my students that digital health is like a newborn baby now, or maybe an infant, definitely. But when we see it coming of age, 5, 10, 15, 20 years down the road, there is no doubt that, according to, I tried even to kind of, obviously it's impossible to estimate with any, degree of accuracy, but I would roughly say that I would not be surprised if even already in 10 years from now, like 3/4 at least of modern technologies, digital technologies, AI and all of that will somehow be related to health. And I'm sure we will be witnessing it even by criteria such as, for example, the amount of apps, or the share of apps, the share of data, and so on and so forth. Because that's inevitable. It's about us. It's about health. It's about longevity. It's about human life. It will be there.
Thank you very much for sharing your vision, for sharing your knowledge. And I would like to wish you a lot of luck and success with your projects, with current projects, and with the future one. And
thank you very much
for coming to Medentee Talk.
Thanks for having me.